So, menstruation can pose some challenges if not handled properly, which is the whole idea of ensuring proper hygiene during menstruation. The woman needs to wash properly, wash frequently, take great care of themselves because naturally, anytime the menses is about to happen or soon after the menstruation, the woman is prone to getting yeast infection, candida infection in the vagina. So regular washing during menstruation would help to minimize the incidence of that. If it occurs, the woman needs to just see their doctor and then to be sorted out. It's also very important to maintain good personal hygiene. Change your sanitary wear, be it a tampon or the sanitary pad, regularly, and then wash frequently so that whatever blood is coming does not stay there for too long and get infected. If you don't uphold good menstrual hygiene practice, you're going to get a lot of infections that can spread into the rest of your body and that can really make you sick. You can get what we call pelvic inflammatory disease, which if not treated properly can affect your tubes. The tubes are what the eggs will go through when you menstruate. The eggs pass through the tube. The eggs will pass through the tube when you menstruate, and then when you ovulate, I beg your pardon, then the eggs will pass there. If you don't observe good hygiene, you get infection coming up through the cervix, which is the mouth of the womb, into the tubes, and into the rest of the abdomen, and that will damage these tubes. And once these tubes are damaged, in the future, pregnancy becomes a problem. Again, if you are a girl and you bleed and it's too excessive, you bleed so much, you have to change your pad about 4, 5, 6 times because it's all getting soaked. That is a bit on the high side. You need to report it to the hospital. You'll be given appropriate treatment to take care of that. Or if the flow lasts for more than 5, 7 days, it is something that we need to look into to see if there's a problem so that it can be treated for you. So the menstrual cycle is typically for 28 days. We divide it broadly into 2 halves: the follicular phase and the luteal phase. So the follicular phase is day 1 of your menstruation up to day 14. During that time, the eggs we spoke about in the ovaries are developing. These eggs will develop up until they reach a good size that they are able to get released. So when the eggs are released, that process is what we call ovulation. So once ovulation happens, then the next phase, what we call the luteal phase, begins, and that takes another 14 days. The process happens, hormonal changes, so many changes happen in the body in getting ready for a possible pregnancy. Once the pregnancy does not happen, the preparation that has happened inside the womb, the thickening that has happened inside the womb in order to receive pregnancy has become wasted, sort of, and so it will be shed out. And so that shedding happens, and that is what flows out as the menses. So the womb inside has been thickened in order to receive a possible pregnancy. No pregnancy happens, so the thickening is all going to flow out as the menses. And that is the end of the luteal phase once the flow begins, and then the follicular phase begins again. And so the time that the woman or the girl is not safe is the time that the woman is ovulating. Once the egg is released, which is approximately 14 days to your next flow, then when the woman has unprotected sexual encounter, the sperms are going to fertilize this egg. The egg is able to survive for 24 to 36, 48 hours. And so when it is released today and there is sexual intercourse by tomorrow, unprotected, that egg can get fertilized, and that will be pregnancy. And so that period is when the woman is not safe. Or for the woman who is trying to get pregnant, that is the best time she's fertile. To be sure you are enforcing good menstrual hygiene, take regular frequent baths during your menses. The baths will help you to clean up nicely and keep yourself clean and get rid of any body odor, and also prevent possible infections. When you have cramps during your period, you need to report it. Are unbearable. There are safe medications that will be prescribed to help ease the cramps. You change your sanitary pad or tampon regularly. You don't want to leave it there when it is soaked for a long time, because it brings the risk of infection very high for you. You don't use any soap inside of the vagina, because naturally there are bacteria and other organisms in the vagina. If you use soap, you're going to destroy those ones, and some other ones will grow and give you infection. Don't use any of these vaginal wash products. They are not safely advisable for you. They will damage the normal bacteria and give you problems. Look out for any signs of what we call sanitary pad rash, because it may mean that you are reacting to certain sanitary pads or towels, and so you avoid those and use other ones. If you use a tampon, you don't leave it there for too long. It can really get infected and give you a bad infection, which might require that you be hospitalized. Do the right washing technique. When you're washing, you wash with clear water. As you get into the shower and you wash, you may see the blood trickling down. It's no problem. Just wash. It will go and enter the drain. You don't need to worry about it. And then finally, keep yourself safe.